I have taken so many lessons from my, on very tiny but very important the positions as a decision maker for the health reforms in our country. We did using a step-by-step approach to reshuffle our universal health insurance system. Next year, we are having the 50th anniversary of our universal coverage. Under the speedy aging, we are having a serious pressure for the budget deficit as a result of increasing population of elderly generations. Those are the health expenditures for elderly people has been increasing in a very drastic way and cause a very serious budget deficit. So now that our universal insurance system may face a very serious difficulty to sustain itself. Therefore, firstly, we increased the co-payment for patients from 10% to 20%, finally 30%. In addition to that, we always try to manage the official payment systems for suppliers to diminish our own health expenditures. This is also very unpopular for those of the suppliers group, such as the medical suppliers. In addition to those of the serious, the approach for balancing the budget, our government adopted the policy contained in the increasing size of the medical doctors population. We realized that if the size of the medical doctors has been widening, inevitably medical expenditure is increasing. So if we successfully contain the increasing figures of our total medical doctors, maybe we can contain those are the consistent medical expenditures increasing. But we adopted so many procedures to contain the increasing medical expenditures in a various way, but mostly we use the step-by-step approach in order to avoid political risks, you can imagine. However, as a result of those step-by-step approach, unfortunately, the negative accumulated the sentiment against the government decision making for health reforms happened finally in the Japanese politics. And also the shortage of the medical doctors, especially in the local area, happened in the recent years. As a result of those, the outcomes of our containment policy for health expenditures created the tremendous negative sentiment against the government health reform policy itself. This was one of the cause of the defeat of the Liberal Democratic Party, which I belong to. So now, Japan has already experienced the speedy aging and how we should respond to the aging process. But it's not the model for other countries. Now the global aging is taking place, including in Asia and the Pacific. So the governments and policymakers are now facing very serious difficulties how to build up their own sustainable the health services endorsed by the sustainable financing. but it's better for them carefully designed the strategic package for their own health reforms and explain consistently and effectively to the public and build up the consensus on which they should carry out their own mission of health reforms in a much, much shorter period rather than longer period by the step-by-step approach. This is one of the political experience we had, and I have already taken as a very serious lessons. As well as we are talking as a mortality rate as a prioritized criteria of the success or not. I can say that our mortality rate is only at 0.2 per million. This rate of mortality is extremely low in comparison with the other countries' mortality rate. But honestly speaking, we don't understand the reason why we could achieve this sort of the performance. Policy may have some positive impact on it, but there are several other social determinants which can positively contribute for containment and also the previous lessons for the major players. And also I have to say that the function of family can be decisively important to protect their own family members, of course including child. Therefore, the role of the mother can be regarded as one of the most crucial in order to cope with those of the influenza pandemic in the future as well. So now we have to carefully study and creating scientific evidences on which we have to clarify those are the series of social determinants and also the health policies, the positive aspect. And then we can understand what happened to us and the reason why our mortality rate was such a low. And then we can do the same thing again. We have already talked quite a lot about how the regional approach is necessary to cope with those of the futures of the pandemic and the various the infectious diseases. Therefore, several initiatives happened to the surveillance networking, but unfortunately, those are the existing initiatives for surveillance in these regions are very competitive and also lost the sustainability. This means that the policymakers in this region should have their own much stronger political motivation to comment on the health issues and maintain those the political momentum as agenda for themselves. And then create the core part of the decision making in the region for future more effective the regional systems, including the surveillance and of course other collaboration in the most effective way. But unfortunately, the ASEAN is one of the most outstanding the regional entity. But still that ASEAN has not enough the function to cope with those the health issues. Maybe the ASEAN plus 3, and also including Australia and New Zealand, we have to create those are the regional package in which we can identify some authoritative, the core, the policy planning, the function in which we can design futures the regional approach, which can be endorsed by the member states. And then we can create those sustainable regional approach for the future's pandemic. Maybe this is one of the important subject we have to overcome.